The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years' experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning and welcome to Pain Free Today. I'm your host, Denis Thompson, and this is not a repeat. We are live today. We're getting ready to go to Las Vegas for the Pain Interventional Show. So those of you who are listening in the Vegas area, we will be at the Cosmopolitan Hotel. We will be there from Wednesday through Saturday. Giving treatments to doctors and their patients from all over the United States. So if you are going to be in Vegas, just give us a call at 954-256-0045 and get a time, and we would love to meet you in person. And last week we were talking about a number of examples of how the ARP Wave System neurotherapy worked on different cases. And I think we'd like to expand upon that because I got a lot of email that intimated that that was a very informative show for those folks. So for those of you who are listening for the first time, what we're talking about is neurotherapy. Not physical therapy, neurotherapy, the direct opposite of physical therapy. It's designed to add to the therapeutic regimen, not take away from the therapeutic regimen. Think of it this way, that wherever you have pain, wherever you have restricted range of motion, wherever you have any symptoms whatsoever, is where the problem ended up. It is not at all where the problem is coming from. Now, that's very difficult for most people to kind of wrap their head around because everyone, for the most part, treats you where you say it hurts or where you are exhibiting those symptoms. Unfortunately, that's why it takes so very, very long to recover from just a simple thing like an ankle sprain. The ankle sprain is not the problem. It's where the problem ended up. That's not what caused the ankle sprain, and it certainly wasn't an athletic activity that caused it. What it was is that the nervous system didn't send the right signal fast enough to the muscles to do what they were supposed to do. So in reality, it was not a physiological problem, it was a neurological problem. Unfortunately, we treat it exclusively as a physiological problem. Henceforth, it takes a long time to recover from just a simple thing like an ankle sprain. So what is neurotherapy? Well, neurotherapy is a system, and it's created by the ARP Wave company, and basically it's the ARP Wave system of neurotherapy. And we're training doctors all over the world and medical practitioners all over the world in this therapy. We're showing them how adding this therapy to their practice can dramatically change their patient outcomes. And you can only imagine why. If we're working on the origin and the majority of them are working on where the problem ended up, it doesn't take a genius to figure out that if you're working on the beginning of a problem, you're going to solve it a whole lot faster than you're working on the end of a problem. So in deference to all the doctors and providers and medical providers and medical professionals, they're trained in the physical side of medicine. They are not trained in the neurology of an ankle sprain. That is for sure they're not trained in. So what is neurotherapy? Neurotherapy is a therapy that focuses exclusively on the nervous system's ability to send the appropriate signal to your muscles in your body to turn those muscles on fast enough to where those muscles can act as a shock absorber and absorb forces coming into your body. So let's use the example of an ankle sprain. If you sprain your ankle, it isn't the ankle that's the problem. Unfortunately, again, as we said, that's where we're going to be treating it, but that's not what caused the problem. What caused the problem is the muscles above the ankle didn't do what they were supposed to do. Because had they done what they were supposed to do, the force would have transferred into those muscles and not the ankle tendons and ligaments. Understand, tendons and ligaments are not designed to absorb force. Muscles are. And anytime we have a tendon, ligament, joint, meniscus, cartilage, injury of any kind, it's a straight signal that the muscle didn't do what it was supposed to do. Just that simple. Now, there's a couple of ways that force enters into the body. One of them is it overwhelms the body. No matter how efficient you are, if you can't absorb the force of getting hit by a bus, then you're going to get hurt. But the overwhelming majority of injuries that we have today, which are not what I call overwhelming injuries, are caused by the nervous system just not doing what they're supposed to do. And so what neurotherapy does is it identifies, is the nervous system doing what it's supposed to do? And if it is not, then the first step is we have to turn that switch back on to where that signal will go to the appropriate muscle so the appropriate muscle can absorb the force, not the tendon, ligament, or joint. Now, if tendons, ligaments, or joints are absorbing force, it's just a matter of time before you're going to have a tendon, ligament, or joint problem. So any of you listening today, if you have, say, carpal tunnel, if you have a shoulder problem, if you have a knee problem, if you have a hip problem, if you have a foot problem, and everybody's treating your knee, hip, foot, that's where the problem ended, not where the problem is coming from. So which would you rather have a treatment of? Where the problem ended or where the problem is coming from? Now, many of you have suffered pain for many, many years. And sometimes it goes away and sometimes it comes back. And if we're on medication, we kind of hide it until the medication wears off. But it's always there. And we've gone through multiple levels of treatment. And it's still there. Ask yourself why. Why does that pain still stay there? Well, I submit to you the answer is we've never worked out where it's coming from. We've only worked out where it ended up. And, you put ice on it, it feels better. You take medication, it feels better. But when the ice wears off and the medication wears off, the pain's still there. And then out of the clear blue, it goes away for a while, and then it comes back. How many times have you heard somebody say, well, this happens about every 2 or 3 years, and it just comes back? It doesn't come back. It's never gone away. Just hidden from you. So wouldn't it be nice if you just get rid of it? Well, that's what neurotherapy does. Neurotherapy works on the actual origin of the signal which is causing the pain, gets rid of the signal, and then retrains your muscles on how to do what they're supposed to do to begin with. Now, if you don't think that's a major problem, let me explain. I can go into, and we can send our staff into any building, any business, any athletic organization, anywhere. Everybody listening on this show today, we could test you. Over 85 to 90% of you are going to fail the test, which means over 85 to 90% of you are either going to be hurt or already are hurt or already have pain. You have pain because your muscles aren't doing what they're supposed to do. And once they do what they're supposed to do, in most cases, the pain goes away quite quickly. So neurotherapy is just that. It is a therapeutic system, and it has three components to it. The first component is we have to identify, is the nervous system working correctly or not? So we do a diagnostic test. We call it an external EMG. For those providers listening, they understand what an EMG is. But this is an external EMG because the muscles are the outward expression of the nervous system. The second thing we do is we diagnose, with the help of you, the patient, exactly where the signal is coming from that's causing the pain. Now, every single diagnostic tool that we use today in modern medicine tells you exactly nothing other than the fact that this is where the problem ended up. You get an MRI, it tells you exactly where the problem ended up. You get an X-ray, it tells you where you broke a bone or where the problem ended up. You get an ultrasound, it tells you where the problem ended up. You get a CAT scan, a scan of any kind, and it tells you where the problem ended up. What it doesn't tell you is where is the signal coming from that's causing the symptom. Now you have that availability as a provider, as a medical professional. You have the most sophisticated diagnostic tool you will ever see, and it tells you exactly where to treat. Not treating a knee because that's where the problem ended up, treating where the symptoms and the signal of those symptoms are coming from, not where they're ending up. Because only when we find the origin of a problem are we going to be able to resolve the problem. And that's what neurotherapy does. So in the first step of neurotherapy, we identify, is the nervous system working or not? Is it doing what it's supposed to do? Is it sending the right signal to the muscles to allow them to absorb force? And it's a very simple test. You just lay down on your back, raise your leg up. We put light resistance on it. And if you can't hold that leg, then the nervous system isn't doing what it's supposed to do. And it has absolutely nothing to do with strength. You know, when I raise a leg up in the air and I ask somebody to resist, and they're a very, very strong human being, they're absolutely astonished that they can't resist a slight amount of force. They associate strength, the ability to lift weight, with the ability to absorb force. And that is a monumental error. They are dramatically different. The ability to lift a weight, the physical ability of the muscle is just that. It is a physical ability. You could be the strongest person in the world, run across the street, tear up a hamstring. Why? Because you could not absorb force. And the overwhelming majority of you listening today cannot absorb force. So ask yourself, where is that force going? Well, I can tell you. It's going to tendons, ligaments, and joints. And if you have a tendon, ligament, or joint problem, now you know why. Nothing miraculous about that. Your body just isn't doing what it's supposed to do. Once you get your body to do what it's supposed to do, what do you think's going to happen to your tendon, ligament, or joint problem? It goes away. Why? Because the force isn't going in there anymore. So in neurotherapy, we identify, is the nervous system working correctly? If it isn't, we get it working correctly. The second thing we do is we diagnose exactly where the signal is coming from that's causing the symptoms. And then once we find that, we treat it. And how do we treat it? We treat it by breaking your old pattern of movement, by building your body's ability to absorb force. Right now, if you have pain, I guarantee you do not move the way you did when you were a younger child and didn't have pain. That is a neuro pattern. That has nothing to do with physiology. Unfortunately, we try to break that pattern physically, through physical therapy, through exercise, through just trying to do it. That will never work. It won't work because you're fighting a neurological signal that says this is the way I'm supposed to move. So what neurotherapy does is it retrains your body. It neurologically re-educates your muscles to do what they are supposed to do. And the second that happens, your movement pattern changes, your range of motion changes, your pain changes, and your overall outlook on life changes. So if all of that is possible and all of that is true, then why in the world haven't you done it? Well, probably because you've never heard of it before. So we're going to give you the opportunity to try it at absolutely no cost and no obligation in a provider close to you. And what we'd like you to do after this show is call your doctor, ask him if he offers neurotherapy. If he doesn't, say you'd like to be treated with neurotherapy, and we'll set up a time that's convenient for you and the doctor to where we can treat you at no cost, no obligation, first to determine if neurotherapy can help you. So you have absolutely nothing to lose and everything to gain. So as we progress through this process, there's only one way you're ever going to know if what I'm saying is true, and that's to try it. And if you can try it at no cost and no obligation, then why in the world wouldn't you do it? So give your doctor a call. Ask him if you could be treated with neurotherapy if he doesn't offer it. If he says no or she says no, I'm just not interested, then give us a call. Call us at 954-256-0045 and ask us to put you in touch with one of our providers. And one of our providers will treat you at absolutely no cost or obligation. And you'll see firsthand, by yourself, if neurotherapy can help you or not. Now, I've been asked to talk about many of the different issues that neurotherapy is successful on. And again, I'm not a doctor. I'm not here to diagnose disease or injury, and I'm not here to give free medical advice. But what I am here for is to explain to you how neurotherapy works and many of the examples of how it works. Because then and only then will you truly understand the depth and the perception of neurotherapy. Because it's dramatically different than physical therapy. Physical therapy is an extraordinarily long-term educational-based program that works on the physical side of the problem. That's why they're called physical therapists. And they're extremely skilled, extremely gifted at what they do. But what they do is not what we do. And what we do is not what they do. So neurotherapy just looks at things in a completely different light. It looks at it as a neurological problem, not a physical problem. Example, we were talking about ankle sprains earlier. And as an ankle sprain, everyone treats the ankle. So it might take, maybe 3, sometimes 4 weeks before an athlete can return to play or competition because of an ankle sprain. Now, you want to hear something very interesting? If you had an ankle sprain 20 years ago, it was the same amount of time. If you had an ankle sprain 40 years ago, it was the same amount of time. If you had an ankle sprain 60 years ago, it was the same amount of time. Now, how many of you drive a 60-year-old car? Well, my guess is the overwhelming majority of you do not. So with that in mind, why do we use a therapy that's 60 to 100 years old and expect a better outcome? Your question, my question, your answer. I have no idea why we do it. Now, in neurotherapy, the way we look at an ankle sprain is completely different. We look at it as what caused the ankle to sprain. And it wasn't getting hit. The simple answer is the muscles above the ankle didn't absorb the forces coming into the body, so the force had to transfer someplace, so it transferred into the tendons and ligaments of the ankle. And now you have an ankle sprain. And then if you treat where the forces came into, which is the ankle, do you honestly think you're solving the problem? Absolutely not. What you're doing is you're getting rid of the symptoms, but the problem's still there. Not only is the problem still there, but it has a lingering effect. And that is that when you sprain that ankle, you create what we call a joint receptor problem. So the joint receptors in the ankle can no longer send the proper signal to the muscles, which weren't working to begin with, and now they're really not working. So now every time the athlete or the individual participates in any activity over and above walking, all that force is transferring where it is not supposed to go. So it's probably transferring to the knee, to the hip, the back, or the neck. And if you check back and look at if you've had a knee problem, if you've had a back problem, if you've had a hip problem, ask yourself a simple question. Did I ever sprain my ankle? If you did, more than likely the reason you have the reason you have the ankle, the reason you have the hip problem or the back problem or the shoulder problem or the neck problem is because you sprained your ankle. If you create an electrical short in an electrical appliance, it does not work. And based on that one simple fact, if you look at your body as an electrical appliance, if there is an electrical short in your body does not do what it's supposed to do. And that electrical short is a neurological short. It is not a physiological short. Again, the word short would indicate electrical, not physical. But we don't look at things like that. We don't look at your body as an electrical being. We look at you as being more physical than electrical. And based on that simple fact is how medicine and the medical staff is trained to work with you. Physical therapists are extremely gifted at what they do, but they're fighting a major flaw. And that flaw is that the reason we need physical therapy is because the nervous system is not doing what it is supposed to do. And if the nervous system was doing what it was supposed to do, we would have very little need for physical therapy because the muscles would be doing what they're supposed to do. They'd be absorbing force, and we'd have very few injuries or symptoms caused by them not doing what they're supposed to do. So, as we proceed through understanding neurotherapy, let's just simply look at it as it is a way of identifying where the signal is coming from that is causing the problem. That's what we're doing. We're identifying where the neurological signal is coming from that is causing the physiological problem. And until we do that, we're not going to solve the problem. anytime soon. So let's talk about some of the things that we've seen. I was with a group of doctors in Florida just in the last couple of weeks. And we talked about the FCA show last week and some of the cases that we ran into. Well, after the show, we began following up with the doctors who are interested in becoming providers of ours and going through our therapeutic program and training program and teaching their staff on how to do and how to administer the ARP Wave System neurotherapy. And so in that process, we have to show the doctor, just as though we have to show you, the patient, that neurotherapy would be a great addition to their practice. The way to do that is simply treat some patients. So if you listening today are in pain, if you've been told you need surgery, if you've had surgery and it failed, if you have restricted range of motion, if you have any symptoms whatsoever that you've had for a considerable period of time, there's only one way to know if neurotherapy can help you, and that's to have a session. And we're so convinced it'll help you that we're teaching the doctors throughout the entire world to give you a complimentary session. Complimentary means it's compliments of the doctor. It costs you absolutely nothing but a little time. There's no cost, there's no obligation, and in as little as 15 to 20 minutes, you will know beyond a shadow of a doubt if neurotherapy can help you. Now, we're convinced because we've treated over 75,000 patients with better than a 95% success rate. So we know what the end result is going to be. The trouble is you don't. So again, if you're in pain, if you have restricted range of motion, if you've been told you need surgery, if you've had surgery and aren't happy with how fast your recovery is, if you've had a failed surgery, a failed back surgery, a knee surgery, a hip surgery, if you've had joint replacement surgery, if you've been told you have carpal tunnel, if you've been told you have chronic pain, there's only one way to know for sure if neurotherapy can help you, and that is for you to try it. So give us a call. Call us at 954-256-0045, and they will basically set an appointment for you with one of our providers. But before you do that, this is what I would like you to do. I'd like you to pick up the telephone, call your doctor, and ask your doctor if you could be treated by neurotherapy in their office. If they say yes, we will set that up, and if we have a representative, how neurotherapy can fit very nicely into your doctor's practice, but more importantly for you, the patient, show you beyond a shadow of a doubt if we can help you or not. If your doctor says, well, I'm just not interested, there's not enough information, there's not enough studies, whatever, then just simply give us a call. Again, 954-256-0045, and we will put you in touch with one of our providers. And one of our providers will treat you at no cost, no obligation, with the understanding is that when you're done, if it has helped you, which we're sure it will, then you agree to be treated by the doctor, or at least tell the doctor that you would like to be treated. That's all we ask. We know we can help you. We know we can help the overwhelming number of you. The trouble is, you don't know that. And the only way you're ever going to know if what I'm saying is true is to try it. And if it costs you nothing, and there's no obligation whatsoever, then why in the world wouldn't you try it? So I've been asked to talk about many of the people that we've been able to help. So I'll take a couple of examples, and we'll will go through the entire process with you, so you understand exactly what to expect when you go to your doctor or when you go to one of our doctors, and you have your free complimentary evaluation and treatment with neurotherapy. The neurotherapy is part of the ARP Wave system, and the ARP Wave system utilizes proprietary tools, technologies, techniques, all comprising into what we call neurotherapy. So with that in mind, again, if you have any doubt that we can help you, if you think it sounds way too good to be true, you're right. But there's only one way to know for sure, and that is to try it. So give your doctor a call, and if your doctor says, no, I'm not interested, give us a call, and we will put you with a provider who certainly will be able to help you. That number again is 954-256-0045. And I see we're running down on time. However, I think because we are on a holiday schedule, I don't think our system is working correctly, so I don't even know if our spots are being heard. And if they aren't, I will just continue to reach out to you and explain to you all of the benefits of neurotherapy. So let's talk about a case that we had last week. Began working with a doctor, and he said, I'm going to bring you 3 of my worst case patients, 3 patients that I've been unable to make any satisfactory changes to. And let's see if neurotherapy can help them. And I said, I would be happy to do that. So let's talk about patient number 1. Patient number 1 is an individual, a younger man, who was very, very, very athletic. Actually competed in the Olympics as a distance runner. And this athlete, for over the last 4 years, has been in extreme back pain. Younger person, not like many of us listening today, but a younger person. And couldn't bend over without pain, couldn't twist without pain, of 8 or 9 on a scale of 1 to 10. 10 is excruciating, 1 is very little. So 8 or 9 is quite substantial. And he couldn't do anything. He couldn't compete. He couldn't have a quality of life. He works for this doctor and had a very difficult time doing his job. And he asked me, what do you think neurotherapy can do for me? And I said, well, I have no idea. But let's take you through the system and find out where the signal is coming from that's causing your pain. He said, well, I know where it's coming from. It's coming right from my back. I mean, I can't even move. My back is killing me. And I said, okay, I need you to think about this. Wherever you have pain is where the problem ended, not where it's coming from. So in your opinion, that signal is coming from your back. We're going to prove to you in a not-too-distant future, probably in about the next 10 minutes, that signal is definitely coming from someplace else. So we began the process, and I had him lay down on the treatment table, and we muscle tested him. I tested his muscles to see could they absorb force. So we had him raise his right leg, and keep in mind, this is a very strong individual, and he couldn't absorb the slightest amount of force. And it was very hard for him to understand how a simple test like that would tell us, the staff and myself, that he was unable to absorb force. And the other leg was exactly the same way. So I then said to him, I said, let me ask you a question. If you were a house and you were built on stilts, and I cut the stilts out from underneath your house, what is going to happen to your house? And of course, the answer to that question is the house is going to fall down. And I said to him, your house is falling down. Your stilts aren't working. And he said, well, how's that possible? And I said, it's real simple. As the force comes into your body, it comes into your lower extremities first. If your lower extremities cannot absorb that force, where do you think that force is going to go? And he said, well, it's going to go to my back. I said, that's exactly what's going on. That force is going directly to your back. So the first thing that we're going to do is we've got to get that force transferred out of your back into your legs. And he said, well, how are you going to do that? And I said, well, let me give you a simple test. So I had him stand up, and I said, I want you to sit in this chair. So as he sat in the chair, I said, I want you to sit upright, and now I want you to stand up. And I watched how he stood up. And how he stood up was how probably 95% of you listening to this today are going to stand up, and that is he leaned his body way forward, put his hand on his legs, and he pushed himself up, and then he stood straight up. Well, in the process of doing that, he's leaning forward. Well, now, if you're sitting in a chair right now listening to this, I want you to lean forward and tell me where you think the force just went. The answer to that question, for those of you who aren't mechanically engineers, is it went to the middle of your lower back. So every time you get out of a chair and you lean forward, the force is transferred from your legs to your back. Is it any wonder that we have so many back problems? Because we have a ton of people who do not have a single clue on how to use their legs to get in and out of a chair, something as simple a task as that. And keep in mind, this is an Olympic athlete that we're having this conversation with. So I had him stand up, and I said, okay, stop when I tell you to stop. And he leaned forward, and when he got about a quarter of the way out of the chair, I said, I want you to stop right there. And I said, now I want you to think about two things. Where do you have pain? He had two levels of pain. He had back pain and knee pain. I said, look down and tell me where your where your knees are. He said, well, they're above my feet. And I said, okay, tell me where the force is. What do you mean? Where do you think the force is? Oh, the force was in his knee. Okay, now his back is not upright. His upper torso is leaning forward. I said, now where do you think the majority of the force is? He said, in my back. I said, what are your two major problems? Back and knee. I said, okay, what level of pain did you have coming out of the chair like that? He said, 8. I said, all right, fine. Now what we're going to do is we're going to transfer that force completely out of your back and your knees. And you're going to tell me what level of pain you're going to feel. He said, well, how are you going to do that? I said, just sit in that chair. I'm going to stand in front of you. Your arms are going to be fully extended out in front of you. And for those of you listening to this who have back or knee pain, try this. It will absolutely make perfect sense after you do it. Until you do it, it's not going to make any sense at all, because we don't look at things as force absorption. And force absorption is a neurological phenomena, not a physical phenomena. So I said, all right, I want you to sit in that chair. I want you to put your arms straight out in front of you. I'm going to stand in front of you. And here's the rules of the game. Under no conditions can your chest or your upper torso come forward, and under no conditions can your knees go forward of your ankles. So you're going to have to push your feet into the ground. I'm holding you so you don't fall backwards, because you're not going to be able to do it on your own. And you're going to have to keep your upper body perfectly erect. Now stand up. He stood up. I said, what level of pain do you have in your knee? None. What level of pain do you have in your back? None. What did I do? Well, I don't know. What I did was transfer the force to the muscles where it should have been going to begin with. Now, the problem with that is you and he can't do it on your own. Impossible. If you could do it on your own, you would have already done it, and you would have eliminated your pain in your knee and your back. But you can't do it on your own, and the reason you can't do it on your own is because it is not a physical pattern. It is a neural pattern that needs to be neurologically changed. The reason neurotherapy is so incredibly effective is just because your brain can't tell your body what to do does not mean an external brain can't. And our proprietary technology, our proprietary protocols, our proprietary techniques will do just that. It will replace the signal that you are unable to send to your body. So now once I had him standing up and sitting down with no pain, he was utterly amazed. He said, I haven't done that for years. I've not been able to stand up without pain of 7 or 8 every single day of my life. And I said, well, man, you're way, way too young to have to deal with that. You're way too young if you're 100 years old. But certainly you're way too young at your age. So he said, well, what can you do? Because keep in mind, we haven't even done any therapy yet. So I said, well, the first thing we got to do is we're going to find out exactly where that signal is coming from. He said, well, it's coming from my back. And I said, all right. So we're going to lay you down on the table, and the doc, who's a neurologist, said, this is fascinating. You're now going to be able to find out where that signal is coming from. And I said, yeah, doc, where would you treat this patient? He said, well, we treat him in the back. I said, all right, so we're going to put an electrode on the back, right where it hurts. We're going to take another electrode. We're going to put it off to the side. We're going to ground it out of the way. And we're going to turn the power up. And as we're turning the power up, I need you to tell me what you're feeling on a scale of 1 to 10. It will never be pain, but there'll be a little buzzy feeling there. So he said, okay, I feel it. I said, all right, now, what level of discomfort do you have in your back right now where this electrode is? And he said, well, very little. And I said, well, then I can categorically tell you that what you think you have, you don't, because if the signal was coming from here, it wouldn't be very little, it'd be a whole lot. So he said, really? And I said, yep. So now we began scanning his body. And for the practitioners here, we're scanning for sodium-potassium leakage. In other words, we're scanning for scar tissue. In any place we find scar tissue, we find an electrical disconnect. And anytime there's an electrical disconnect, let me ask you a very, very simple question. If I unplug your computer, is it going to work? Of course, the answer is no. What makes you think your body isn't the same way? So if there's an electrical disconnect, there can't possibly be any electrical communication going on in that area. And if there's no electrical communication going on in that area, and muscles communicate by electricity, how in the world do you expect the muscles to know what to do if nothing's telling them what to do? So we began scanning the body, and we found a spot way, way, way away from where he thought. We found a spot in the middle of his leg on the opposite leg. So most of his pain was on the right side of his lower back. We found where the signal's coming from on the left side of the leg, inner thigh. Then we took the red electrode, put it right back on the back, turned the power up to exactly the same level, and asked the patient, okay, is that more or less than what it was before? Because keep in mind, we found the beginning signal, but every signal has a beginning and an end, so we've got to find the ending signal now. So now we start scanning with the red electrode, and lo and behold, we find the red electrode location is on the opposite side in the calf. Then I asked him, have you ever strained your calf? Oh, yeah, I strained it, a couple of years ago, about 4 or 5 years ago. I said, what happened first, the calf strain or the back? Well, he couldn't remember, and I said, well, think back. Which came first, the back pain or the calf strain? He said, well, now you bring that up, it was calf strain. I said, okay. Now, again, let me use a simple analogy. If the shock absorbers in your car don't work, where is the force coming into your car going to go? It's going to go to your frame. So in your case, and I told the athlete this, in your case, when you strained your calf, you shifted all the load to the other side. When you shifted all the load to the other side, because it hurt on the side that your calf was strained, you started overworking that side. Then that side couldn't handle that force, and so the force had to go someplace, and guess where it ended up in your case? It ended up in your back. He said, that's amazing. So I said, okay, now we've seen, and I told the neurologist, I said, now you know exactly where that neurological signal is coming from, which is causing these physiological symptoms in the back. And I said, you already told me, Doc, that you were going to be working on his back, and you can see I'm nowhere near his back, and we're going to see the difference. So with that in mind, we began the treatment process. And as we began the treatment process, I had earlier asked him, what movement bothers you the most? And he said, the thing I cannot do is I cannot bend forward and touch the ground. I haven't been able to do that for 5 years without extreme pain. I said, okay, well, we're going to bend over, but we're not going to touch the ground. We're only going to touch your knees. So as I watched him bend over to touch his knees, it became very clear he had no conscious clue of how to do it. Now, keep in mind, this is an Olympic athlete who can't even touch his knees without serious pain. So I said, the first thing I want you to do is I want you to touch your knees. Tell me what level of pain you're in right now. He says, 7 or 8. So, okay. Now, I'm going to teach you a different way of touching your knees, and I want you to tell me what level of pain you're in. He said, what do you mean? I said, well, you're touching your knees by simply dropping down and fighting through touching your knees, but you're not using the right muscles to do that. And he said, what do you mean? I said, I want you to push your glutes to the rear as far as you can go. And then as you do that, tell me what happens to your hands. Well, as he pushed his glutes to the rear, his hands went down and touched his knees automatically. I said, what level of pain are you in right now? None. Why? Because I transferred the force out of his back into his hamstrings and his glutes, so consequently there's going to be no pain. Again, there's no way he can do that on his own. So we began the therapy, and we began to neurologically re-educate him on how to move. And as we did that, the first 5 repetitions were very, very difficult for him to do. Didn't hurt, but they were just tedious to do, hard. And after the first 5 repetitions, I asked him, okay, what level of pain do you have in your back right now? He said, none. I said, Doc, did you hear what he said? He said he had 0 pain. Now, this doctor's been treating him for years, and he said, are you sure? And the patient said, yes, I'm sure. I have no pain in my back at all. And the doctor said, I understand now what you've done. What you've done is you've found out where the signal that was causing the pain was coming from, and that signal was causing the muscles not to do what they were supposed to do, and now you get him to do what he's supposed to do and stimulate that signal, and he will have no pain. And I said, you're absolutely right. That's exactly what we're doing. And so I explained to the patient, you think you're cured right now, you're not. All that's happened is we took a muscle that was in almost like a fist, and we allowed that muscle to go into full extension. And when we allowed that muscle to go to full extension, you immediately had no pain. Unfortunately, that muscle is going to go back into a fist in about an hour and a half to 2 hours because that's where it feels comfortable. That's where you've trained it to be. The reason you need to go through therapy is every single session is going to retrain that muscle to stay in the proper position for a greater length of time. So today it might be an hour and a half and the pain starts to come back. It'll come back a lot less than what it is now. Then the next day of treatment, that hour and a half is going to go to about 3 hours. The next day it's going to go to about 5 hours. The next day it's going to go to about 8 hours. The next day it's going to go to about 10 hours. Until such time as we get you to 24 hours where you have absolutely no pain above what I call mobility pain, which would be 1 or 2. So as we went through the process and continue to go through the process, and each of these sessions lasts approximately 30 minutes, at the end of 30 minutes, I asked this individual to do the very same test that I asked him to do earlier, which was touch his knees, and ask him then, after the therapy, what level of pain did he have in his back? And he said, absolutely none. I said, okay, now what I want you to do is go down and touch your toes. He said, I can't do that. I said, no, you think you can't do it. I want you to do it. But before you do that, I want you to make sure that your glutes are all the way to the rear and you aggressively go down and touch your toes. He did it. He came back up and he had this gigantic smile on his face and he said, I did it. I said, I know you did it. Now go down and touch the ground. He said, I've never been able to do that. I said, go down and touch the ground. So he touched the ground. To make a long story short, did we do anything miraculous? No. All we did is found out where the signal was coming from that caused the problem, got rid of the signal that caused the problem, and taught the muscles how to do what they're supposed to do, which is absorb force. Prior to that moment in time, he had no ability to absorb force. Henceforth, the force went to his back. So that was patient number one. Patient number two was a gentleman who was in a deer stand about 20 feet off the ground and fell. And he fell and fractured both legs, both ankles, and instantly had severe, severe back pain. And this was about 8 years ago. And this individual walks in kind of like the Tin Man. Couldn't bend, couldn't do anything without extreme pain. And based upon the fact that he had extreme pain, we went through the entire process with him just like we did with the earlier athlete. And this is the doctor's second patient. And as we put this individual and tested to see if the muscles were doing what they were supposed to do, every single muscle in his body failed that test. Every one of them. Now, in the process of the surgical intervention that was needed to help this guy back from such a severe injury, they fused his foot. So his foot was fused for 8 years. Couldn't move his foot. Absolutely could not move his foot. So here were his conditions. We had a back condition, we had a leg condition, and an ankle condition. The knee was scheduled for another surgery. This time they were going to completely replace it. Prior to that, they had just cleaned it up. Now they're going to replace the one. The other one had already been replaced. And the one that had been replaced was about 6 months post-surgery. At 6 months post-surgery, he was at a 95-degree range of motion and had just come back from physical therapy that day, and the doc told me the maximum they got him was to 95 degrees. I said, okay. So he said, what do you think you can do with this guy? And I said, well, again, I have no idea, but, I got a pretty good indication of what's going to happen. When he fell out of the tree, I mean, again, obviously there was some serious damage, but the damage caused was not the reason the damage was caused. And I said, what do you mean by that? And I said, well, obviously, when you fall out of a tree at that height, you're going to create a major, major bioelectrical disturbance. And I'm going to find out where the signals are coming from that's causing the pain in the back and causing the inability for the foot to move and for the knee to go into flexion and extension. He said, really? I said, yep. So we put him through the same process all over again, laid him down, had him raise his legs up, couldn't resist, had him hold his arms in, couldn't resist, had him hold his fingers in, couldn't resist, couldn't move his foot, was in extreme pain. So we did the same diagnostic test, put a black pad, and I asked him, what area bothers you the most? Is it your back, your knee, or your foot? He said, well, my knee. My knee hurts, and I said, on a scale of 1 to 10, what's it feel like? He said, probably feels like a 7 or 8. I said, is that all the time? And he said, look, I'm on OxyContin right now, and it's a 7 or 8. And I said, okay. So it's very, very severe. And he said, absolutely. And I said, all right, so let's have you lay down, and we started searching his body, and we found that where the pain was in his knee was coming from about 17 inches up on the medial side of the opposite leg, not the leg that he had pain on. And we found the secondary signal in his glute on the opposite side. So again, he fell out of this tree, landed heavily on his right leg, crushed everything in his right leg. Left leg took a little abuse, obviously. But all the pain was on the right side. All the signals were coming from the left side. Now, do you think we'd be very successful if we treated him on the right side? And the answer obviously was no, because he's been treated there for the last 8 years. So now we say, okay, now we're going to do the treatment. And he said, well, what's involved in the treatment? I said, well, you're going to sit in that chair and you're going to stand and sit 5 times. He said, I can't sit in a chair without extreme pain. I said, well, I think you'll probably be able to do that right now. So we had him sit down in the chair and turned up the power to our first designated setting. And I said, stand up and sit down. And we helped him just like we did the other athlete that I talked about earlier. And he had no pain. None. Zero. Zip. And he said, how's that possible? And the doctor piped up and said, all he did is transfer the force out of that joint into the muscle. I said, Doc, that's absolutely right. That's exactly what we did. And this guy was utterly amazed that he could stand and sit. Something as simple a task as standing and sitting without pain just brought just a stream of joy to his face. So we began doing that. We started working, and the end result was he had no pain when he left. So I hear our sounder for the first time in this show. That must mean that we're at the end of our show. If you'd like to try the ARP Wave System neurotherapy at no cost, no obligation, give your doctor a call. Ask them if you can be treated. If they say no, give us a call at 954-256-0045 and sign up for your complimentary evaluation and treatment. There's only one way to know for sure if this can help you, and that is for you to try it. Till next week, this is Denis Thompson, your host. You've been listening to Pain Free Today, uninterrupted, I might add, by commercials. Thank you.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.